Are you preparing for the NCLEX and feeling overwhelmed by pharmacology? Don't worry, you're not alone. In the next 3 minutes, I'll break down the essentials you need to ace this part of your exam. First, let's talk about drug classifications. Understanding the major categories of drugs is crucial. For instance, antibiotics like penicillin fight bacterial infections, while antidiabetics like metformin help control blood sugar levels. Cardiovascular agents, such as beta blockers and ACE inhibitors, are used to manage heart conditions. These categories not only help you understand the therapeutic uses, but also how these medications interact within the body. Now, let's dive into some common medications you need to know for the NCLEX. Digoxin, for example, is used to treat heart failure and atrial fibrillation. It works by increasing the force of heart contractions. Heparin is an anticoagulant, which means it prevents blood clots. Insulin, of course, is essential for managing diabetes. Knowing the mechanisms of action, indications for use, and specific nursing considerations for these drugs is vital. Side effects and contraindications are another important area. Every medication comes with potential adverse reactions. For example, digoxin can cause nausea and visual disturbances. Heparin may lead to bleeding complications. It's also crucial to understand when not to use certain drugs. For instance, beta blockers should be avoided in patients with asthma. These nuances are key to safe patient care and passing your NCLEX. Let's move on to nursing considerations. When administering medications, you need to think about dosage calculations, patient education, and monitoring for therapeutic outcomes and adverse effects. For example, when giving insulin, it's important to educate the patient on how to monitor their blood sugar levels and recognize signs of hypoglycemia. Emphasizing patient safety protocols and best practices for medication administration is critical. Finally, let's talk about tips for memorization. Pharmacology involves a lot of information, but there are strategies that can help. Mnemonic devices like ABCD for beta blockers, atenolol, bisoprolol, carvedilol, and doxazosin can be very helpful. Concept mapping and spaced repetition techniques are also great for enhancing retention and recall. Find what works best for you and stick with it. So there you have it, a quick guide to mastering pharmacology for the NCLEX. Remember, understanding drug classifications, common medications, and their side effects, along with effective memorization strategies, can make a huge difference in your exam prep. If you found this video helpful, make sure to subscribe for more NCLEX tips and nursing education content. You've got this. Subscribe now and keep learning. #NCLEX Pharmacology, #nursing student, #pharmacology review, #NCLEX prep, #nurse life, #study tips, #drug classifications, #nursing education.